Go.
Good afternoon and welcome to the COVID313 Community Coalition for Families and Youth and our town hall. We're so delighted that you are joining us today on this beautiful spring day. And we hope that all of the good vibes and love and caring and thoughtfulness that came from Mother's Day, an opportunity to shine a light on the women who love us and care for us, whether they're our moms, our grandparents, our aunties, a neighbor. We know that we need to lift up and appreciate the role of women in holding our communities together, particularly through this unprecedented time of COVID. So it's within that spirit today that we're going to talk some more about Mother's Day. But before we get into the program, I want to make sure that you are getting comfortable and that you're all prepared. We're looking forward to those of you that are on Facebook to please engage us. Send us your comments. And if you're in the Zoom, take a minute and tell us where are you joining us from. And always, please let us know what are the things that you would like to hear. So officially, my name is Jametta Lilly, and I'm blessed to serve as the CEO of the Detroit Parent Network. But I'm also a proud Detroiter, a mom, a nana, and a member of this coalition. So again, welcome, because we got a great program for you today. But as we're getting ready, the way that we try to do things all the time is to make sure that this is a two-way opportunity. So we are really pleased to always bring you ASL as well as Spanish interpretation. And I'm going to pause for a moment and ask if Veronica would share the greetings and welcome in ASL. Thank you. And Christina, if you would do the same in Spanish, please.
Buenas tardes, todos. Bienvenidos a la charla de COVID-313 aquí de cada semana. Por favor, si quieren asistir a la reunión, estamos en el Facebook de UNI y también estamos en Facebook en vivo. El enlace está en el chat. Gracias y bienvenidos.
Gracias. We have a very special program today. And we would like for you to hold tight because as we know, COVID rates are increasing. We know there are other issues and concerns, our mental health, our understanding of what's going on in our world. And I would be remiss, we all would, if we didn't pause to send out both our prayers and our sincere hope and feelings to support those families in Buffalo. Still another community has been devastated by the disease of racism. Still another community has been devastated as the result of the United States being one of the few nations in the world that has the issues that we have with gun violence. So we, like the coalition, believe that all of us should be informed. All of us need to love on our communities, but also for those who do not believe that they should do what they should do to keep us safe, whether it's from guns, to keep us safe as women, to have the control and the right to manifest our own self-determination on our bodies. To those people, we say no more. No more to virulent racism, no more to those who do not want to honor women's self-determination, no more to those who worship guns over people. We say, we're going to vote. We're going to be informed. And so that's what we do all the time, is that we bring you information and we bring you resources so that you as a family can be safe and empowered. So let's transition into this really substantive program that we have for you today. But we please ask you to keep Buffalo, Mother Emanuel, Columbine, all those families and the everyday families in the city of Detroit, Chicago, and everywhere else in this country that are being devastated by the horror of guns that are unleashed in our communities. So I would ask, just for a moment, if we could just pause for prayer, a moment of silence to recognize still another horrible event that's taken the lives of too many. Life is precious. And someone to remind us about how important life is and how precious life is one of our own team members. Because Terry Whitfield, if I don't mind saying, you know about a new life that's coming, right?
You know I do, Mr. Meta. You know I do. How you doing today?
I am blessed and highly favored, brother. How are you?
Hey, sun is shining, birds are chirping, and I'm co-hosting with you today. It does not
Wow,
get any better than
we've
that.
never done this before. Okay, we're really going to have a party today. So with our focus in on life, we've got to talk about our health, because health is wealth. And who better to talk about that than a future dad? And that's you, Terry Whitfield. So we're all
Thank you, Jametta.
Yeah.
You,
So, I just got to tell the world. You only told a small part of the world. I'm telling the other half.
Okay.
Okay.
Well, it is a pleasure.
So I'm kicking it to you. I'm kicking it to you because we've got to hear from our own awesome Detroit Health Department that is part of our public health infrastructure to keep us informed. Terry, you've got it.
Thank you, Jametta. Good afternoon, everybody. As Jametta said, my name is Terry Whitfield. I have the pleasure and honor of serving as a program officer for the Skillman Foundation. I am the son of Rosalind Whitfield. I am the bonus son to Audrey Austin, and I am the husband to soon-to-be mom, Shay Hicks Whitfield. And again, it is a pleasure to be here today. And I get the opportunity and the pleasure of talking about health with COVID rates on the upswing. It is a pleasure that the coalition has to have friends in high places. So would love to bring on Nurse T, Nurse Hackney from the Detroit Department of Health. As always, great to have you here, Nurse T.
Good afternoon. It's always a pleasure to be present. Thank you for the invite.
No, thank you for joining. And so would like to give you, we've got a whole bunch of questions, but wanted to give you time to be able to give us a heads up. What's happening at the health department with the increase of cases, COVID cases. What is happening, and how can we best prepare ourselves to withstand, the negative effects of this most current surge?
Mr. Whitfield, there's so much going on. It's so much going on. As we know, we're in a pandemic and things are changing every single day. I have so much information. The CDC has changed its guidelines as far as travel and asking individuals for domestic travel to test at least 3 days before your departure, to test at least 3 to 5 days on your arrival. Detroit Health Department is now test to treat, which means we are offering antiviral after you test positive at one of our sites, and you can actually get an assessment. They'll ask a lot of questions, ask about your medications, your history, must be 12 years of age and older. It's important to ask if you're immunocompromised also, but if you qualify, you can actually get treatment on site. We found that it was a lack in the city of Detroit, so we wanted to make sure it was available for our Detroit residents. Also, again, there's so much new things. We have the schools calling us, asking for education. We know that Detroit public schools, other schools, the cases are rising all over the city. Mask mandates are being placed back again at the schools all over the place. To continue to keep our residents of Detroit safe, we're asking, as of yesterday, please wear a mask. If you're in a public place, indoors, wear a mask. It's highly recommended. Our numbers, and I can share my screen just to share what our numbers look like as of this week. And if you look at the right side of my screen here, you're going to see Michigan, 16.3. Oakland County, 20.7, Macomb, 22.6, St. Clair, 24.2. As these numbers keep rising, we're looking at Detroit City at 4.8. That looks low, but we have to keep in mind these numbers are not including individuals that are not testing, that may not have any symptoms. This is readily important. We're seeing people get tested using the home test, but not reporting the test. So we have to keep that in mind. Although these numbers for Detroit look low, we're seeing hospital cases increasing, and unfortunately, parents are sending their children to school sick. So it's important that we keep utilizing what we know has been working: vaccines, masks, social distancing, taking a test, and if you're sick, stay home. Those are vitally important, and hand hygiene. So important.
Thank you for the sobering report. Again, when you see it on the news or you hear about it, it hits differently than when you have somebody that is really in the thick of it, letting us know that, you know, we have to get back to the basics. One of the questions that that we've heard a lot about is the difference between the at-home test and the positivity rate, and then the PCR test. From your opinion and from the opinion of the health department, which tests are accurate? When should I, move from a home test to get a PCR? If you could just talk through some of that process.
That's a really good question. And we utilize our nurses line for the City of Detroit residents to be able to call, so we can kind of walk you through that. Anyone can call us at 313-876-4444 and talk to us. The recommendation is, if you're feeling ill, if you have access to a home test, take the home test. I will say nothing is 100%. We have to keep that in mind. You can take 2 home tests, but the antigen tests are a little tricky, because when you do take an antigen test, it depends on if you're symptomatic. It has to be within a couple of days of you having COVID. It won't pick it up like the PCR, maybe later in the COVID infection. So it will only pick it up at a certain time. PCRs, I know, are available at Beaumont Urgent Cares. They are doing a 2-hour return PCR test. There are other ways to get a hold of any other tests, going to michigan.gov/coronavirus test to get the nearest testing site to you. The Detroit Health Department, call us at 313-230-0505 to get the nearest location for COVID testing to you. But if you're having symptoms, stay home, because we don't just have COVID, we have still the flu, we still have allergies, we still have the common cold, and it's hard to determine what is what.
That is true. And it's better to be safe and keep yourself healthy, as well as keeping, your neighbors and your community healthy as well. Would like to bring back to the stage a friend of the coalition, Dr. Dennis Cunningham with the Henry Ford Health System. How you doing, Dr. Cunningham?
Hey, how are you? It's good to see everybody. I'm glad you're well.
Good to see you as well, and glad that you're well as well. And Nurse T, please stay on. This is meant to be a two-headed monster, if you will, as it relates to health. But Dr. Cunningham, just wanted to give you some time to talk to the community about what you're seeing and what's happening at Henry Ford Health Systems as it relates to the surge that we're in right now, with COVID-19.
So this is mostly an outpatient surge for Henry Ford. We have some hospital admissions, but nowhere near the numbers with the past surges. As our previous speaker mentioned, we're seeing lots of flu, lots of COVID. It's so important to get tested early because if you have risk factors for severe COVID, older age, cancer, chronic medical conditions, including diabetes, there's medicines that we can prescribe if you're caught early, that first 5 days. There's 2 antivirals you can take by mouth. We have monoclonal antibodies, which are proteins made in the lab to neutralize the virus. So I encourage people get tested if you're sick. We have medicine for flu, we have medicine for COVID, and if it's not either of those, you get peace of mind.
It helps if I come off of mute. Dr. Cunningham, just wanted to get your perspective on the question that we asked before you were able to jump on. There's a lot of questions in the community about the tests and which tests are accurate, when you should get a PCR. Nurse T gave us the health department's perspective. Just wanted to hear from you and from Henry Ford, kind of your perspective and any advice that you would have as well.
So the at-home tests, if you have symptoms, especially the first 3 days of symptoms, they're pretty good. If you don't have symptoms, the at-home tests are depending on which brand you have, 20 to 60% chance of finding the virus. If you have symptoms, much higher numbers. If you don't have access to a home test, or if you have chronic medical problems, I really encourage you to get the PCR testing at a hospital or a doctor's office. A little bit longer turnaround. The home test is 15 minutes. The PCR takes a couple hours, but that is the best test. And if you're at risk for severe COVID, that's the test I want to know to tell me if I need to treat you or not. Now, if you have a positive test at home and you call me, I'm going to believe you and I'll prescribe the medicine. So you don't need to repeat testing if you have a positive home test.
Awesome. So it's great when 2 professionals really build on each other's information. So thank you for that, Dr. Cunningham.
Anytime.
I think for Nurse T, you mentioned that the schools are calling, and that there's the constant partnership between, the Detroit Public Schools Community District and our charters. Like, what guidance is the Detroit Health Department providing schools during this time?
Education, reiterating education. Right now, we're getting ready to meet with charter schools, going back into Detroit Public Schools and doing maybe town halls to reiterate those tools that we've talked about utilizing before, masking, getting the children vaccinated. As we looked at those positivity rates, unfortunately, our minors are not getting vaccinated. That's the lowest group that's not vaccinated. So if we can encourage our parents, keep educating our parents, getting our parents educated. Unfortunately, the city of Detroit is just at 50% of being vaccinated. So what can we do to encourage vaccines for COVID? Educate. And whoever's vaccinated being the example. Uh-oh. I lost.
Nope, you're good.
Oh, my screen went black.
That's how good the information was you gave us. Your computer did a mic drop. Dr. Cunningham, if an individual is exposed, so I'm in a space, I get a call, they say that they've been diagnosed with COVID. What recommendations should we follow? The CDC has this set of recommendations. Nurse Hackney has spoken to some of the recommendations from the city, and we know that Wayne County has recommendations as well. Just how should individuals lean as it relates to the recommendations that they follow for if they're advised that they were in close contact with somebody?
So all the guidelines are pretty similar from public health. They're on the same page. The most important thing to know, is it really an exposure? It should be 15 minutes within a 24-hour period. If people are wearing a mask, the chance goes way, way down. So if I know that you've been exposed, I get a phone call today and someone says, I'm positive COVID and we were in the same room a couple days ago, I'm probably going to stay home. Certainly, if I feel any sickness at all, I'm staying home. And I might choose to do a test a few days later. That's one easy way to know if you're infected or not. Without symptoms, the PCR test will be better. But when in doubt, stay home if you can. Certainly, if you can work from home, if you're lucky enough to be in a hybrid model temporarily, I think that's important. And if there's any chance I might be infected and I absolutely have to go out to the grocery store, I'm going to wear a mask anyway, because it's a courtesy to other people. Plus, I'm protecting myself. I'm a big believer in the vaccines and the masking, and those two things together, I truly believe will help keep us all safe and interrupt the transmission.
Awesome. Thank you, Dr. Cunningham. Nurse T, you know, a lot of parents within Detroit Public Schools Community District were excited for the partnership between DPSCD and the health department as it relates to vaccines. Is there any updates you can give us with how that partnership is going, especially in what you spoke to, the need to increase the amount of vaccinations within our young youth population?
I love these questions. Yes, the vaccination collaboration is good with Detroit Public Schools. I would say the only fear is educating the parents again, so we can encourage them to bring and allow their children to get the vaccine. Detroit Health Department and DPSCD, we do have pop-up clinics that are scheduled for the summer. If I share my screen, love sharing my screen, I can give you a list, and some are at the schools. This needs to move over. So we have some at Pasture Elementary. We'll be doing what we call an August Blitz before school. It'll be every weekend every Saturday in the month of August to be able to get all vaccines, not just COVID, but all vaccines, to get any adult or child vaccinated with any vaccines that they're needing to have. Because we know we've seen a decrease in, being able to go to the doctor's office. So we need to get our regular updates because we're seeing increases in hepatitis and other things. So we need to make sure we're back getting vaccinated.
Awesome. This is an awesome graphic. And also to know that every Saturday, in August, if you need a vaccine, whatever vaccine you're looking for, that there's a space and a place across the city where families would be able to go. So thank you. Thank you for the graphic. Thank you for the information. What we'll do, Dr. Cunningham, is close on this question right here. And it'll be kind of a twofold. One is, are we in an endemic state? Like when we think about the flow from pandemic to endemic, does this most recent surge kind of point towards us remaining in a pandemic, or this is just a part of what that endemic state might look like? And then lastly, any recommendations for best ways that people can remain safe during the summertime, especially as we're going to be outside, we're going to be around other people, just best ways that we can remain safe?
Well, as far as keeping safe, the vaccines, especially if you're eligible for a booster, get one. If you look at Michigan, people 12 years of age and older, the number of people who got their primary series and at least one booster is only 37% for the whole state. So get your vaccine. I think wearing a mask can't be stressed enough. I keep a bunch in my car whenever I get out to go shop. I just throw one on. Outdoors is safer. I love going for walks around the neighborhood, going to the parks. The further apart you are, that's pretty safe. Are we in an endemic? I don't believe we are. I would still say we're in a pandemic because every time we get a new variant, we're going through the same surge. We're having a lot of swings where cases go up, it goes away, then a new variant comes here. So I don't think we're in the endemic stage yet. Will it happen? Probably. I think what's most promising is that there's some vaccine trials where they're looking at a universal coronavirus vaccine. Not all the proteins change between the variants. And if you can get a vaccine that will hit those targets that aren't changing, that's going to give us the best hope to get out of this cycle of corona variants. Walter Reed Army Institute is probably the closest one. They do incredible research. I used to work with them. They have some incredible people there. I'm hoping that that pans out.
Dr. Cunningham, Nurse Hackney, just thank you again for being friends of the coalition. Your expertise and knowledge is tremendously helpful to the community as we continue to wade through this pandemic state that we're in. So thank you for all you do. Thank you for continuing to make time to be here with the community, and safe travels.
My pleasure to join you. Thank you, everyone.
Thank you.
Thank you.
I want to encourage before I get off that the CDC does have a calculator to fill out questions for quarantining. It really helps you. You basically, it's a drop down and you go through the questions and it'll tell you exactly what to do. If anyone needs help with that, the nurses at the Detroit Health Department can walk you through that. Just give us a call, 313-876-4444. Thank you.
Thank you, Nurse Hackney. Appreciate you and appreciate that information. Jametta, I am tossing you back the ball.
Got it. Okay. And you don't know this, but a million years ago, I was actually a shortstop. That was pretty awesome. So pretend my hand is a mitt. I got that. Thank you. And thank you, Nurse Tanea and Dr. Cunningham. This month is also special for a lot of different things. It's also National Mental Health Awareness. And we all know how important our mental health is, but also our social emotional health, and particularly even the health of how our babies are feeling, our infants and toddlers, our preschoolers who may not be able to articulate their feelings. But we also want to make sure, as we think about National Maternal Health Month, is to recognize that the pandemic has had a particular impact on women, who are, in the majority of cases, the caregivers. They're also the people that have been most adversely affected by the still having to care for not only the children, but also seniors, their senior parents and others, and try to figure out how to navigate this thing called Zoom. And at the same time, stay well, physically, emotionally, and even spiritually. So we've seen some real upticks in the concerns and mental health needs of women. But we've also seen a really profound and dramatic issue, which is the ongoing institutionalized racism in our healthcare system in general in society, but in particular in healthcare, has resulted in the highest level of Black maternal deaths in decades. We are looking at a death rate amongst Black women in terms of their own mortality of giving birth or either very soon afterwards from the 1800s. So this really demands not only a view, but also advocacy. And I'm really so proud to say that Detroit is home to many powerful organizations that have been focused on this critical area of health disparity. But while we're talking health disparities, we're going to go into a segment. I'm really looking forward to having someone from one of our partners, Urban Neighborhoods Initiative, or UNI, as we like to call it. Tracy Gallardo, and please correct me if I mispronounce your last name, is going to talk to us about young women's mental health. So sometimes we're talking about women who are older, in their 30s and older, but the reality is that our girls and our young women have been trying to navigate and have had a whole particular set of things to deal with. So Tracy, welcome to the program, and we'd love to hear you talk about what you've been seeing and what are some of the things that we in the community can look for and how we can help support the mental health of our young women.
Yeah, of course. Thank you, Jametta. And hi, everyone. My name is Tracy Gallardo. I am the mental health specialist at Urban Neighborhood Initiative, and currently I provide counseling for use in the Southwest Detroit area between the ages of 14 and 24. And just kind of adding to what Jametta said, with COVID and kind of what has been going on, there has been a rise in the need of mental health services, but especially among our young women. And it's very important to kind of be aware of why this is going on, but also to see how can we be proactive as well as provide preventative care. So at the moment, twice as many young women has experienced depression and anxiety at some point in their life in comparison to our young men or men in general. Eating disorders has been one of the major disorders that has impacted young women. And surprisingly, young women are more likely to attempt suicide, even though men are more likely to die from suicide. And a common issue for young women is low self-esteem, especially in reference to body issues, because with social media and kind of like the societal expectation that, our young girls, women have to look the ideal, like, weight of being slim. And that has kind of been ingrained in our minds as a woman myself, but also, our young teens and young women adults. And that's very important because there's just kind of like of the content exposure that has been, shown among our young women, and especially here in this country. And again, there's not to say that, mental health in men is not as important, but however, our focus is on women's mental health because there has been a rise of cases among young women, especially because of COVID. And I know we are still going through a pandemic, especially with cases rising at the moment again. And, it could feel like there isn't an end to this. And because of COVID, it has impacted a lot of people's mental health, and even myself. So many of our healthcare providers and workers majority of them are females. And because they've been working during these hard times, there has been an increase in development of PTSD, depression, anxiety, burnout, during and even after the pandemic peak, and even and this might be an ongoing thing, especially with cases even rising and new variants coming out. And because of COVID, people having to quarantine, there has been an increase of domestic violence and violence against women and young women due to quarantine and having to be in the household of staying in the same space as their abuser and feeling like there is no escape, especially having to be around them during quarantining. And also a study done by CARE, which is an organization that focuses on young women's and women's health and mental health all over the country, did a recent study about mental health disparity between men and women, but especially during COVID, and they saw that 35% of females had moderate to severe levels of depression compared to 19% of males in just the past year, as well as 27% of females have moderate to severe levels of stress compared to 10% of men, and 37% of women ages 18 to 24 report suicidal thoughts compared to 70% of men. And again, this has been in the past year. And the reason why this is important, because this is just showing that there is a need for mental health services and support, especially among our young women. And I know this kind of raises the question, well, what can we do? Are there resources? So surprisingly, I tried to find specific women, young women mental health resources in the Detroit area. And even that was a challenge for me. I know there's resources out there, it's just kind of having to find them. But I know CHAS, the Community Health and Southwest Service Center on 4th Street in Detroit, they have La Vida, which works with survivors of domestic violence. You can always call the clinic and click option 9 to be directed to La Vida. They provide free counseling services for survivors of domestic violence or abuse, as well as provide legal aid. Also, the Detroit Wayne Integrated Health Network has a helpline that's 24 hours. If you need someone to call or even to find mental health services for yourself, that is a line you could always call. And also something to keep in mind why the need for mental health is rising on young women and women is not only the societal pressure, social media, but also because of the pandemic, women have to be juggling multiple roles, and that is, being a mom, a student, a caregiver, an employee. So just having to navigate all through those roles, especially during a time of pandemic, could cause a lot of stress and anxiety among women. That's why there has been an increase of statistical data among young women. Also, another important thing that is important, self-care. I know that has been emphasized a lot by, mental health specialists, therapists, clinicians. Self-care is important, but something to keep in mind is that only you know what works for you. Like I said, everyone is different, so self-care looks different for everyone. So I don't want any other young women or women to feel pressure that there's a specific way to do self-care. It's different for everyone. Like for me, my self-care is doing crochet, which for someone, that's not what relaxes them, distress them. It might be them reading a book or talking to someone or something like that. And another thing to think about self-care is therapy might not be for everyone, and that's okay, but just finding what works for you. So if it means finding a mentor or another young woman that you have a strong relationship that you want to talk to, that's always another option just for you to decompress and distress, especially when we're going through times like this. And also another thing that I want to share out is listening to podcasts. I know since a lot of us have been home, sometimes we've been listening to a lot of music, but sometimes there are podcasts out there that focuses on women's mental health. And these are two high-rated podcasts. And I even had reached out to one of my fellow girlfriends, asking her, hey, what podcast do you listen to so I could present today? And she said she likes to listen to Therapy for Black Girls. That is a podcast that focuses on mental health. And that's something that she listens to. And for me, I like to listen to Latina, which is a podcast that focuses on mental health among young women in the Latinx community. So again, the reason why all this information is important is because we want to be proactive in what we do. We want to be more aware of our young folks that we're working with, and being there to be a support for them, especially if it means just asking our young women hey, are you okay? How are you doing? Just checking in with them is as important as not doing anything. And hopefully we'll be able to combat this or find a way that we could decrease the statistics, because at the moment, the need for mental health is high.
Tracy, thank you so much for giving a really thorough and overarching discussion about all the different factors that are making this time in particular even more difficult for young women. With COVID, with the increases that we see in social media that in many cases denigrate women in general, and comparisons, etc. I'm wondering, Tracy, could you share, for example, are there support groups or anything that you could share that that you could direct young people to go to? So part of good mental health is having people who are good and nurturing for you in your circle. You know, what's your network look like? So what would you advise to tweens and to parents even of younger people about how to rethink who people hang out with and where you're getting your message and what's your support group? Could you talk to that a little?
Yeah, that's a very good question, Jamila. So even at the moment, even for me, like I'm currently work with 5 mental health advocates who actually are young women between the ages of 14 to 24. And we are based out of Urban Neighborhood Initiative, and they actually provide monthly wellness workshops in which they do more of that peer-to-peer guidance. So UNI is always posting events that are coming up for them, and they actually are doing more of that peer-to-peer workshop internally as well. So with that being said, so kind of looking in your community with like different organizations like UNI, I know Congress of Community, Lindsay has the Nuestro Futuro program that works with young people as well, and I know they're doing stuff with mental health, so even looking into them. I know La Vida also has a lot of like support groups for young women and girls, especially when it comes to dating violence and safety and things like that. So there is a lot of resources in the community. Like I said, it's just kind of looking for them. And also there is a lot of support groups in churches too that I've noticed that, you know, there's like support circles for young women, young people. It's just kind of figure out what works for that individual and what works for everyone.
Thank you so much. And I'm hoping, and maybe you can be an advocate, and so can all of us, that even these informal support groups get listed on the DWIN site so people know where to go. That's the challenge, isn't it? Always. There are resources, but knowing where they are and how to get to them. And before we close, I just want to also thank you and thank all of the culturally responsive community and mental health providers that are out there, because it's important that we have people from our community that look like us to serve the people in our community in a way that's respectful and also understands culture. So we're particularly pleased for all the resources that we have, both for our Latinx communities. We're seeing an increase for Arab American and certainly for African Americans. There are culturally responsive and wonderful people, parents and young people that are here to help you, because all of us need some help. If not all the time, sometime more than others. So thank you.
Thank you so much.
We're going to switch in the program. I'm going to hand it back to Terry because we're moving into, if we see things that outrage us, that means that we got to get busy as advocates, and voting matters. Right, Terry?
Yes, my man. Oh, wait, I'm on mute. Oh, no, I'm not on mute.
No,
I'm back. Okay. Yes, and to help us dig into this conversation, I'm going to bring on our friend, our partner in all things that are good in education, the Deputy Director and Policy Lead for 424, Miss Arlisa Hurd. Hey there, Arlisa.
Woo!
How you
Come
doing
on,
today?
Oh, wow.
Yeah, it's real.
Hi, Terry. I'm telling you, I'm like, who is he talking about, actually? I don't know. Hi, everyone. It is good to be back with you all. It's been so long. I'm almost in tears. But thank you so much. I just wanted to share a little bit about what's happening in these education streets here, actually here in the state of Michigan. In just a second, I'm going to play a quick clip for you, but I want to talk to you all about vouchers. The school choice proponents are at it again, and you may say, okay, what are vouchers? And so very quickly, this voucher scheme that seems to be happening across the nation, it's not just here in Michigan, but in particular, Michigan, these vouchers are basically state-funded scholarships. That's quote scholarships. That's the terminology that's being used to kind of soften the blow of this thing. And it sounds really good and healthy and all of that. But it's nothing more than taxpayer dollars that are given to families so that they can use at private schools. And currently, we have the group of folks that are pushing this thing are the billionaires Betsy and Dick DeVos. Some of you may be familiar with them, but the DeVos family seems to be the bankrollers who are funding this effort across the state. And their ballot initiative, they're calling it the Let My Kids Learn ballot initiative. And once again, this is not a one-off or a lone wolf effort. This is part of a national agenda that we're seeing across the nation. In fact, Tennessee, the state of Tennessee just the higher court just ruled the vouchers are not unconstitutional. So we're seeing this happening all across the nation. And so these school choice proponents, they've been trying to get a voucher system or a voucher style system here in Michigan in the name of education reform. And they've been at it for the last last 2 decades, the last 20 years, and they're really pushing it now. But I want to step back for a second because I want to play a little bit of this clip that I think is going to be very helpful in helping us to really understand how vouchers work. And I'll come back after that.
Georgia legislators have debated educational vouchers on and off since the 1950s. At its most basic, a school voucher is an amount of money provided by state government to parents for use at private educational programs, like tuition at private schools. In 2008, Georgia passed a voucher that acts as a tax credit. Tax credit vouchers redirect money that would otherwise have entered the state's general funds instead to tax shelters that are then paid to parents for use for private school tuition. Georgia's tax credit voucher program commands $100 million each year, or enough to pay the salaries for 2,200 public school teachers. To date, Georgia has lost out on $650 million because of this tax credit voucher. More recently, Georgia legislators entertained passing a more traditional voucher that would take existing state funds provided to public schools and instead move them for use in private education programs. Voucher proponents make the case that these policies are revenue neutral, since the state would spend the same amount on a public school as a private one for each student. What is ignored, however, is the disastrous effects vouchers can have on individual school budgets. If a school loses 3 students to a voucher program, they cannot cut off 3 seats in a school bus or reduce the heating bill by 3 students' amount. These fixed costs remain regardless. Even if only 5% of Georgia's students use a voucher, the effect of the loss of state funds can be incredibly damaging to the schools that educate the remaining 1.6 million children. The loss of students to unaccountable private schools can have particularly disastrous effects on rural school systems that rely more heavily on state funds than the rest of the state. Georgia schools are already struggling to pay for costs that increase while revenues remain flat. Vouchers would exacerbate these struggles, particularly for rural Georgia. State lawmakers that want to support Georgia's students should resist vouchers and continue to invest in policies that have actually proven to work. Adequate and fair funding for all of Georgia's schools.
Okay, thank you. So
You may say, well, wait a minute, that was Georgia. How was that? Listen, that came from one of our national partners in Georgia, actually, National Partners to 482 Forward. And believe it or not, that is the exact same thing that is happening here. So if you remember earlier, I said this is a national agenda. It's not just specific to Michigan. This seems to be happening across the country, and the same type of things can happen here. I think we have a one-pager. Molly, if you can put it up. Are you able to share your screen?
Yes, give me 1 second.
Okay. Well, I just wanted to while she's putting it up and everything, the same exact thing happens here. This is not, we believe it's definitely not good for Michigan schools because it puts public education in competition with private. It reduces and reallocates public school funding to private schools. The state loses the revenue because what would have normally come in taxes, which is how we fund our schools, it would go right back out to private schools. So you're looking at right now, it's like a one-pager, just kind of show how this
this voucher initiative, this Let My Kids Learn initiative would work. So corporations would donate to organizations that support vouchers for private and religious schools. And it's not just corporations. Also, wealthy individuals can also donate money to these organizations, and the voucher is created in those organizations. That money would go to parents, not in hand, but that money is applied to tuition that parents can use to go to take their kids to other schools. And as a result, the corporations and the wealthy individuals get dollar for dollar 100% tax credit. And in addition, so it's a sneaky way to go into the school aid fund and the general fund to basically remove dollars. It's like this backdoor scheme. And we stand to lose that revenue, and the general fund and the school aid fund. There's so much money that we need for our schools and for our services. It's not just schools. It's all of our, it's public safety, it's mental health resources, all of these things that we would not be able to fund if this continues to happen. So what we really want people to understand is what's happening now and what can we do about it. We want folks to get in this fight with us to stop and block this. One thing I just have to add is that studies even show that if parents, somebody may say, well, what about private schools? I'm frustrated with the current school system. I want my kids to go to private schools, but there's really no hardcore evidence to support that private school students are doing significantly better than traditional public school students. And on top of that, when it comes to transparency and accountability, you're not going to get the same as you would in a public school. For instance, private schools can pick who they want to enroll. And also, I don't know if anybody's really been checking out the latest tuition cost in private schools, but the dollar amounts that would be used to go towards private schools won't even touch most of the price tag that most private schools are charging. I, for instance, don't really know too many private schools that are coming in under $10,000, and that's just for starters. So this is a dangerous initiative. It is really about power and money. It's really to give corporations and wealthy individuals tax breaks, and it's really not going to do anything but to continue to further defund our public schools. And it just does not make sense to take money out of the public school system and give it to another system, because as we saw in the video, those fixed costs are still going to remain. The building still needs to be heated up and lit, whether you've got 1,000 students in the public school or whether you've got 400. So siphoning off students and dollars is not going to help schools here in Michigan, period. So at this point, I would like to, Molly, I don't know if we have the links. There we go. There we go. So at this point, you want to say, well, how can I get involved in this thing? Well, one of the things that I want to warn you about, you probably have gone to the grocery stores and Trader Joe's, you name it, they're all over. These petition gatherers, there are petition gatherers that have been flown in from other states, and they're out asking folks to sign petitions for these, quote, scholarship grants. That's the code word, scholarships. It sounds so friendly and welcoming. But what it is, it's the Let My Kids Learn ballot initiative. It is not necessarily the scholarship in the way we're thinking scholarships. It is the voucher scheme. So we're asking folks, don't sign. Don't sign the petitions. Be careful. Make sure you know what you're signing, because there are other petition gatherers out there that have good causes. So we don't want you to just not sign any petitions, but be careful about what you sign and make sure you're listening out for those key words. The other thing that we also, and I do believe there's a link up, we want you to directly, you could go to the link that's up on the screen. We want you to email your legislator and tell them not to vote this through, because one other thing that we think that's coming down the pike, and we're pretty sure that it will happen. They only need 340,000 signatures to kind of get this thing on the ballot, right? So that Michiganders can vote on it. But in the year 2000, 69% of Michiganders voted against vouchers. So what do we think is probably likely to happen if it goes to ballot? Right. Michigan really doesn't want this. I'm pretty sure of that. So we think that legislators are going to make sure that it doesn't get to ballot. So we want you to get involved. Tell your legislator, hey, listen, don't push this through. Don't force it in without Michiganders voting on it. The link and the information is all up on your screen. I guess if you got other further questions, you can email. You can drop emails in the link and ask questions. But there we go. I think I'm done.
Lisa, it is amazing how you can get all that information out in a way that everybody can understand and still look good while you're doing it. I'm just gonna say it. I'm just gonna say it. You are amazing, my friend. Thank you so very much.
That is so good. I was afraid. This is a lot of information, though, Terry. So you really want to get it in so people understand, but you want it to be, you want to get it all out there. But sometimes racing up against the clock is hard. But I've learned from you.
Well, keeping up with our baseball theme, you knocked that one out the park. Thank you, my friend.
Hey.
Thank you so very much.
All right, Todd. Thank you.
Thank you.
Back to you.
Yeah, a triple thank you, because your voice is so cogent, and always you and 4824 are creating the equipment and the information to move us forward. So you said it, we have to move quickly, because people that are in opposition to the things that we know are nurturing to the health, education, and welfare of our communities are moving faster and quite well financed. So we got to do it on people power. And you're part of our people power. So thank you. Great information. We're going to move into a portion of our program that we think is pretty special. But I want to just hit pause for a moment, because I know that not only are we going to be talking about our Mother's Day tribute, but we also have a number of announcements. And I believe, Terry, that we're doing the announcements first, and then I'm doing Mother's Day, or is it the opposite? So just catch me up. I'm looking at
we're doing Mother's Day. Yep, we're doing Mother's Day first, because mothers come first, and then we're doing the announcements.
Okay, well, thank you. And it's always better to get clarity than have Deja in the background send me a note saying, no, Jametta, you're doing the wrong thing. But we appreciate it, because that's what we've got to do in this program. So as we shared with you, let us never forget, world, that women birth the world. We are the world's women who birth the world. Think about that. Think about it. And so that means that we ought to have automatic appreciation for women who bear children and sacrifice for their growth and development, but also thank you to all of the aunties and mamas who are supporting the role of being a caregiver. So I want to thank Deja Moss, our production coordinator in particular, and all of our partners who submitted part of what we're calling our magnificent moms. We are highlighting these magnificent women that are part of the organizations that have bringing you this COVID Coalition Town Hall now for over 2 years. Let's go to the very first slide to see one of these magnificent women. So each organization was asked to highlight someone about the great and wonderful things that they do. And so as you see in this slide, we are lifting up at Don Wilson Clark. Don is with 4824, which is part of the backbone of the coalition. And the quote for her is, "We admire her dedication to Brightmoor and resilience to continue the work and even use the tragedies that she's experienced for community growth and healing." So let's hear it for Don Wilson Clark. Also from 4824, we are lifting up Sharnice Mickens Turner, because she is ready and willing and able, facing the disparities in the Detroit educational system. And we can see her with her hands on her hips, because she is a mom and making sure that our children have an equitable resources for their education. Thank you. The next slide. Our next mom is also from 482 Forward, and that is Stacy Laurie. Stacy has been an advocate for paid family leave, which we know how important that is, and education justice. She's a mother of 3 and 1 with special needs. I advocate for equity and inclusion for Black and Brown mothers who are often left behind in policies and in movements. We could say that again. Stacy Laurie, thank you for being a magnificent mom. We'll continue with our magnificent moms from Urban Neighborhood Initiatives, and we have Vania Ruiz. Vania works so hard to ensure the youth employment programs are running smoothly, as well as making time for her family. I admire her strength, not only as someone who works in Southwest, love she has for her children. And what I'm reading with each one of our slides, these are the people that these organizations nominated. And for each of these special women, these moms, someone wrote these words about their observation about what makes them special. So I hope as these moms are watching and as their family and friends are watching, you can really appreciate and resonate on these quotes. Also from UNI is Liz Valdez. She is a founder of Southwest Pride. They provide resources such as food and clothes to families. They host events that are fun for families and provide the much needed information and resources. Liz is an advocate for Southwest families, youth, and organizations. Thank you, Liz Valdez. You are a magnificent mom. And I also have another magnificent mom that they have nominated, and that's Karzima Valdez. She ensures that Southwest Detroit's residents have access to affordable internet and that residents are trained on how to use it. And we know how vital that has been during the pandemic. We got to bust down this digital divide. Karzima, thank you for being in the fight for that issue with us. Congress of Communities, one of our very first partners also with our COVID coalition. Fabiola, she's a warrior, always advocating for kids and parents' rights, very supportive and involved with different organizations in her neighborhood and always willing to help people in need. Thank you, Fabiola, for being a magnificent mom. Also at Congress of Communities, we have Daniqua Robinson. Daniqua is a lifelong Southwest Detroiter. She has 5 grown children. She's the resident champion and social justice warrior. Daniqua, we know you, we appreciate you. You are a magnificent mom. Detroit Public Television, DPTV, our partners, we have Tara Hardy. The quote for Tara is, in addition to being a devoted and engaged mom to her kids, she also spearheads DPTV's amazing and award-winning parent boot camps and teacher education programs in the community. Tara, thank you so much for all the work you do, not only for DPTV, but bringing this great programming throughout this area for all kids and families. You're a magnificent mom. Also at DPTV, we have Mary Ellen. Mary Ellen, she manages to do a fantastic job balancing motherhood to her young son with an incredibly demanding job leading our local productions around the city of Detroit and the metro area. Mary Ellen, she always stays kind, calm, and on task. So Mary Ellen, you are obviously a magnificent mom. Thank you. So pleased from our Detroit Parent Network family to for our nomination of Aisha Braswell. Aisha is an advocate in the community who takes pride in assuring that the voices of children with special needs and unique abilities and their parents are heard. Aisha, we appreciate you for not only what you do with your wonderful daughter, but for all families throughout the city and throughout the state of Michigan. Thank you for lifting up awesome abilities families. Also, at Detroit Parent Network, we have nominated Simone Wilkes. Simone acts as a bridge between mothers and resources. She is diligent in ensuring mothers in the community are equipped with the necessary tools to meet their needs. Simone, you are a magnificent mom, not only to your young son Dyson that you see in the picture there, but your other bambino that's with you. So you are a magnificent mom, and we so appreciate you, not only at Detroit Parent Network, but everywhere else, like Hope Starts Here. From Chaz has nominated Jessica Caballero Mirario, and I probably made a mistake there, so give me grace. Thank you. Jessica is an incredible woman. I should read that again. This is what someone has said about you, Jessica, that you are an incredible woman. Jessica has prioritized herself and her family, and yet she continues to deliver quality results and outstanding services to our community. And as we've been saying it before, there's something so special about women that in this place and time can continue to nurture and love on their children, nurture, love, and empower their community. And at the same time, many of them are continuing to work to make all of us a healthier and more thriving community. So that's just some of the few magnificent moms that we are blessed in the city of Detroit to have. I have a challenge for you. In the chat right now, type in the name of a magnificent mom that you know, and then make sure that you call her or send her a text and let her know how special she is, because we need each other. We need our mothers and our nanas and our aunties and our grandmothers to help support our families, to lift up and support our men, support our entire community. So with that, we've got some great announcements that we'd like you to hang on tight, because Terry is going to walk you through things that you need to know to make sure your family's powerful.
Thank you, Jametta. And I just want to say, I take pride in you and knowing that you are a mother figure to so many, auntie figure to so many. So I give thanks and praise and shine greatness upon you for all that you mean and for all that you do to the community, for the community. Thank you, Jametta.
Thank you. So that goes to Mama Larita Yvonne Boyce and my grandmothers, my aunties. We all stand on their shoulders, and I am so blessed because I can say that. Hello, Mom. Thanks.
Yay. So I have the pleasure of announcing a couple of announcements. So first, 482 Forward, youth are petitioning for 300 million counselors. Currently, the legislator has allocated no money towards school counselors. And we know during this time, as Tracy and you and I just let us know, that our young people are struggling now more than ever. So please circulate and sign the petition that is on the screen so that our students can have adequate investment in mental health staff for the 22-23 school year. Next, Detroit Parent Network, Mommy to Mommy Support Group. We know that being a mother is one of the most difficult jobs that goes on 24/7, or as some people might feel, 25 hours a day, 8 days a week. Do you need an ear to listen or someone to relate to? Come vent, unwind, and de-stress with Detroit Parent Network during our private Mommy to Mommy support session tonight, this Thursday, today, March 19th at 7 p.m. Information is on the screen. And then lastly, join Detroit Parent Network on Tuesday, May 24th at 6 p.m. for our Child Care Subsidy Workshop. Come learn about the new laws and benefits. Also receive resources and tips. There are a lot of resources available for families, especially when it comes to dollars to support and offset a lot of the costs that come with being a parent in 2022. So if you're a parent, you need to be at DPN Tuesday, the 24th at 6 p.m. And lastly, Detroit Parent Network, come hear our stories as it relates to long COVID. Join the support group and listening session for those affected by the lasting symptoms of COVID-19, better known as long COVID. That will be taking place next Friday, May 27th from 6 to 7. And the link to register is on the screen, or again with any of these announcements, feel free to give Detroit Parent Network a call. And then Detroit DPTVs will be live streaming the Mackinac Policy Conference May 31st through June 3rd. The Mackinac Policy Conference is a time to focus on civic role during polarizing times. You can listen on Detroit Public Television's Facebook in partnership with the Detroit Regional Chamber. Again, that'll be live streaming throughout the policy conference, May 31st through June 3rd. Please feel free to, again, jump on Detroit Public Television's Facebook page to not miss a beat and to get all the information from the conference. DPTV will also be live streaming Great Lakes Now, Water's True Cost. It is a collaboration between Bridge Michigan, Circle of Blue, Great Lakes Now, and Michigan Radio. So if you're interested in learning more and being more engaged in the water rights movement, please feel free to join the Great Lakes Now live stream watch party Tuesday, May 24th at 7:30. And then as it relates to resources, Wayne Health's mobile unit is here for you and here for your community. So with any information about where that mobile unit is and where and how you can take advantage of it, please visit the website www.waynehealthcares.org/mobile-health-unit. Again, www.waynehealthcares.org/mobile-health-unit, and get the information that you need to see how you can locate the mobile health unit across the community. And then again, the federal government is providing for free COVID tests. So in order to get your hands on your free at-home COVID test, feel free to go to covid.gov, or if you would like to make a phone call, you can call 1-800-232-0233. Again, 1-800-232-0233. Every home in the U.S. is eligible to order a third round of free at-home tests. Make sure you order yours today. And as well, if you are in need of a testing site, if you do not have hands for an at-home test, or you want just the comfort that comes with having a PCR test, feel free to call the COVID-19 hotline at 888-535-6136, and then press 2 to get help for a testing site. Again, that is 888-535-6136. And again, press 2 for help finding a test site. Or you can go to the website, www.michigan.gov/coronavirus/contain-COVID/test to find testing sites. And then for those that are looking to get your vaccine or to get boosted, you can go to vaccines.gov. Again, www.vaccines.gov. In order to find a location nearest you that you can call or visit their website to make an appointment. Again, if you're looking for a vaccination site, you can go to website www.vaccines.gov. All right. I thought we had like 15 more announcements on there, but we're good. Just again, actually, Jametta does this better than anybody. So Jametta, you want to go ahead and close us out?
I don't know about that. But I will say this, what we do it as a family, because we have become a family now. And some of us have even met each other in person still. We're not all together yet, but we want you to know, audience, that this is a collaboration, it's a coalition. We've got people from DPTV, Deja, our production folks, 4824, everyone. This is a joint collaborative effort. We try to walk what we talk. So with that in mind, everybody, please turn on your screen. Let's see you. Raise your hands in the air. Let people know that family, staying strong, staying focused on health and wellness matters. Thank you so much.